it is my pleasure to welcome you all to this event the European Public Health Alliance organizing today about the health costs of air pollution and transport pollution in Europe. We are just letting people in and just let you know, as it is indicated, that the meeting will be recorded so that we could share it after the event. I see that many of you, many familiar names, and I also see that the speakers have joined. So just let me allow to start with some basic housekeeping rules. So as you can see, all microphones is muted just to allow a good flow of conversation. So please leave your micro muted, but do not hesitate to interact. And the way you can interact is the chat box function. We will see it, my colleagues will monitor constantly questions, the speakers will see it as well. So in that way, we can bring those questions into the discussion, and we will make all efforts that no question will remain unanswered either during or after the event. We will follow our brief agenda. So maybe at that point, I would like just to kindly ask the speakers to turn on their camera so that we can, I can just briefly introduce them before then proceeding with the event itself. So as you could see, I would hand over soon to our Secretary General, Sasha Marshang, who will then open the event and welcome participants and share his initial thoughts to guide our discussions, which will be then followed by the presentation and the launch of a new study by Sander de Bruijn from CA Delft, who is also with us. Hello, Sander. And then that will be also the first opportunity when a question and answer sessions foreseen after his presentation. So please keep your questions and put them immediately there so that we can handle them. And the presentations will be followed by a panel discussion. And the panel discussions will start with sharing the video message of Veronica Manfredi, head of unit from DG Environment, and also from his team, although she couldn't join the event, but Vincent will be with us and available to question addressed to the Commission. And I have the pleasure also to present our distinguished panel members. We have MEP Bas Eickhout from the Greens political group coming from the Netherlands. And I can see Bas here. Hi. We're very pleased that you could join us. We have from the European Consumer Organizations, Dimitri Verlia with us as well. Hi, Dimitri. And then we have the pleasure to welcome city representatives, very important players in the field, and we are very keen to hear their voices as well. From the city of Brussels, Louise Dupré, who is Sustainable Mobility Project Manager there. And last but not least, from the panel, we have Benedek Javor from the city of Budapest. And following the panel discussions, we will conclude. And Anne Stauffer, Deputy Director from the Health and Environmental Alliance and Organizations, if I support member of, kindly accepted to make that part. So welcome, all of you. Thanks for being with us. And then given the time limit, then I would like to hand over immediately to Sasha Marshang. And Sasha, please make your opening remarks.
Thank you, Zoltan. I hope you can still hear me all right?
Yes.
Perfect, great. So good morning, ladies and gentlemen, dear participants. Thank you for being here. And so numerous, I think we have over 70 participants, so that's quite good. And I'm sure more people will join the meeting as we go along. Zoltan kindly asked me to provide some opening words, and please forgive me for reading them. My memory isn't the best. It's a very busy time of year. So I'm glad to be here today, of course, to welcome you on behalf of the European Public Health Alliance, or EPHA as we call it in short. Today's webinar is an important step in our journey to better understand the lethal impacts of air pollution on our health, which we examine through the lens of cities via a new piece of research that will be presented today and accompanied by an in-depth policy discussion with expert panel members representing both the European and the city perspective. I'd like to express my gratitude to our 11 national partner organizations who helped us to commission this important report for their support and hard work. And at today's European event, they are also marking the important consequences of the situation in their cities. From our side, holding this important discussion is a contribution from the public health community to the European-wide efforts to mark the 2020 European Week of Regions and Cities and the European Green Week. On this occasion, I'd like to thank our partners, Eurocities, for their continued support and practical help they've provided us with. And of course, also the entire EPHA team for organizing this webinar. Without them, this event could not have taken place. But this week is also Global Climate Change Week. As we're all experiencing the latest wave of the COVID-19 pandemic, we shouldn't forget about the hard work of medical professionals who also recognize the toxic relationship between air pollution, health, and the climate crisis. That is why the European Public Health Alliance is gladly supporting the Medics for Clean Air campaign, through which medical professionals are raising their voices and demanding clean transport and clean air for all. 1 month ago, we recalled the 5th anniversary of Dieselgate, which was an unfortunate scandal of which the health consequences are still palpable. Hence, we strongly feel that bringing additional evidence to the tables of European, national, and city level decision makers is essential. And it's essential for helping us to put an end to illegal levels of air pollution and to stop the aggravating health and climate burdens of relevant emissions. So please let me be clear on this. We need a renewed commitment to a complete phase out of the polluting combustion engine as the only correct conclusion of the Dieselgate scandal. Anything else could be too little too late, and ultimately it could compromise Europe's long-term healthy recovery and ambitious Green Deal objectives. So let me finish where it all began. Our study reveals the magnitude of the damage toxic air is causing to people's health, and also the huge health inequalities that exist between and within countries in Europe. To a large extent, the situation can be influenced by transport policies, and cities can reduce costs by switching to zero-emission urban mobility. Governments and the European Union should bear these costs in mind for transport policy in order to support and not to hinder a healthy recovery from the COVID-19 pandemic. So thank you very much for your attention, and I look forward to a lively and inspiring discussion today. Over to Zoltan.
Thank you very much, Sasha, and thanks for putting the discussion in a context, which I think it is then the right way to proceed then to see what science and what evidence says us to underpin the demands you just formulated. So with that, I would like to kindly ask Sander de Bruin from CIE Delft to make his presentation. Sander, please feel free to share your screen, and then the floor is yours. We are listening to you very carefully. And just allow me in the meantime, remind participants, this is the moment. So please put your questions immediately on the chat box so that we can address them to Sander when the presentation is finished. Thank you.
Yes, thank you very much, Zoltan. So I just shared my screen. And I think that everybody could see the report. It would be good if somebody could confirm that it would be this way.
This is the case, we can see you.
Okay, great, yeah. So, so I will present our research that we undertook basically, well, I think pretty much over the course of the year. This research is investigating the health cost of air pollution in European cities and the linkage with transport. And actually, air pollution is a place I often feel where economics and health sciences can meet. Because we know from the health community that air pollution is actually the fourth biggest cause of death among all health risks. So it's only exceeded by high blood pressure, diet, and smoking. And diet and smoking, for example, you can do yourself as an individual. You have yourself a choice if you want to smoke or not. But with air pollution, actually, you have no choice. And here, this is what we regard in economics as an external effect. An individual cannot choose what kind of level of pollution he wants to consume. So it is imposed on him by others. And we know in economics already almost for a century that actually the solution to this is very simple. You have to internalize this external effect by making the polluter pay for the damage. And this was demonstrated by Pigou, the French economist in the 1920s. And actually you saw that many people felt also, well, this is also fair. So it also was appealing to a notion of fairness. And we see in environmental economics, as I studied it, and this was back in the 1990s, but we also studied this history. So since the 1930s, economists have been involved in trying to estimate, so what is actually this damage? First, this was only of interest in legal cases, because the polluter, he wanted compensation. But since then, it has been growing and growing on, and we call this social cost. And I think that it is very important to realize that social costs are costs both of tangible goods. So this is, for example, medical costs, you know, people that end up in a hospital because of air pollution, but also loss of working days. And it contains intangible goods. So these are goods actually that you cannot measure. You don't know how much they cost, but everybody knows that people want to live in a clean environment and they want to have a long and healthy life. So these intangible costs are, for example, reduced life expectancy. And so economists have been busy in trying to measure those costs. And we have been helped by the medical community because the WHO in 2030 published, and already before, because there have been previous versions, but the 2000 version is the latest version, where they elaborate how you can quantify the impacts from air pollution on numerous health endpoints. And so the present study is basically a study in a row. So we started in 2018 with a study estimating the social cost of diesel emissions at the country level. And this is very relevant because diesel emissions, diesel is a very important contributor to actually the health in Europe, across Europe. In this study, we have been trying to port this knowledge to the city level. And we have been investigating first the social cost of total air pollution, so from all sources, and we have been investigating the role of transport in these emissions. And in the future study, which we are presently starting, we will investigate, well, what can we actually offer to cities? So what are effective transport policies at the city level to reduce these social costs of air pollution? So I will be presenting the middle study here, the 2020 study today. And basically this is a method, and this method is well, you know, if I depict it like this, it is very simple, because you say, okay, first we have to determine the air quality in a city. Then in a second step, we have to quantify the impacts. And in a third step, actually, we have to value these impacts. And in principle, you could say, well, this looks indeed very simple. As a matter of fact, it is quite complicated. That's why we have been busy for almost a whole year. So first, you know, what is actually the level of air quality in a city? Well, this is, of course, not straightforward. So what we did actually is that we took the levels of reported air quality. Cities report this to Eurostat, for example, through the urban audit database. So cities report, so what is the level of air quality in my city? And so this was actually used. However, this data was slightly outdated, so we updated it with the information from the monitoring stations from the European Environmental Agency. And this is a picture here, this landscape where all these monitoring stations for PM10 are depicted. And so we did this in total for 432 cities for the year 2008 for actually 4 types of air pollutants. So this is PM2.5, PM10, NO2 and O3. So NO2 is nitrogen oxide, O3 is ozone, and PM is particulate matter. So then it comes to the calculation of impacts. And there we took the information from WHO, basically, from 2013. So the mortality endpoints were directly estimated using this WHO method. So mortality is people that die sooner because of air pollution. There we took this WHO information on relative risks, and we added their city-specific age cohorts and country-specific incidence rates. Incidence rates is you must imagine, so how often do people actually die? Because these relative risks are presented as the additional risk of the chance of dying because of air pollution compared to the normal death rates. So, and the morbidity endpoints, actually we took their different approach. We used their impact tables with concentration response functions, with city-specific age cohorts and EU incidence rates. So, and here is basically in this table, you can see all the endpoints that we have been quantifying. So these are 16 in total. Also important is to notice that these endpoints apply to certain age groups. So in general, cities that have a more elderly people, a higher share of elderly people in their city population, have actually a higher chance of scoring high on the impacts. So, and then the third step is actually that we have to value. And here we undertook in 2019 a huge study. Well, basically this started in 2017, but it was studied in 2019, where we also, and this was the handbook of external costs for the European Commission, DG Move. So we used their literature review in order to estimate the values for the various endpoints. So, and that is actually an average value for the EU 28. And now the situation in economics is normally that people, if you ask them how much do you value a certain good or a certain product, they often respond to a certain extent depending on their income, because people somehow always keep in mind, so what is the value of a house, for example, and house prices differ greatly in Europe. So it would not be logical to use a common valuation. So we differentiated this according to the guidelines that were recommended by the OECD in their 2012 review, how to measure how to value the health consequences from air pollution. So now I go to the results. So basically this were huge, very substantial spreadsheets that we constructed, calculating this for each of these 16 endpoints. And then we added it all up together in this framework that I outlined. And so we see here that the highest damage cost total are actually for London, followed by Bucharest, Berlin, Warsaw, Rome. And you see that many of the capital cities here, of the bigger countries, are actually in this table. And so received a lot of questions. So before we publish this, so what is basically influencing this? And basically this is influenced by 4 factors. So the most important factor is the air quality. But then also population size matters because bigger cities, there live more inhabitants, so more people are being affected by the poor air quality. And then the income level matters, as I outlined. is that richer people tend to value their health consequences from air pollution at a higher euro level than poorer people. And finally, the age structure matters. And this can explain actually these figures. We also investigated, so what are actually the highest cost per capita? And well, then you know, Bucharest, that was on the second place actually on the previous list on the total damage cost, then becomes actually the number one. But it is followed by some Italian cities in the especially in the Po Valley, which is notoriously have a substantial poor air quality. And we also investigated here, so there are also cities that have relatively clean air quality. And you can see here the cleanest cities. Often these are cities that are also relatively small, but I also see that in this list you also have a city like Geneva, which is not a very small city, and also like Tallinn is just outside this list. I think it is number 14 or something like that on the list of the cleanest cities. So also capital cities can be relatively clean. Then we also investigate, so what are actually the damage cost per unit of income? And then you can see that in Bulgaria, actually this is nearly 10%. And again, I have to state that these are damage costs. These are not expenses. These are like social costs. So these include also people that matter for welfare, but that actually people do not pay. So you cannot say that the people in Roos pay 10% of their income due to the consequences of air pollution. No, but the damage that actually this air pollution causes to them is equivalent to 10%. So actually you could say that these people should have a high interest in improving their air quality because it would add to their welfare. And you can see that actually this difference is quite substantial because there are also cities that have between the 1% and 2% of their damage costs as a share of GDP. And also here you have some capital cities like Dublin and Stockholm, and again Tallinn, that score actually quite good in this indicator. And so again, this is mainly influenced by air quality, age structure, and to a small extent also by the income level. And so we also investigated, so what can we say about the main cause of these emissions? And in our calculation, the main cause is PM2.5 and PM10. Followed, and that makes over 80% of total damage cost. And also the ultrafine particles are part of this. You know, the ultrafine particles, the damage is, we hope, properly included in our evaluation of endpoints for PM2.5. But this is an ongoing debate if there should not be another category for ultrafines. And you can see here that the other ongoing debate is, you know, where to shift, what to attribute to NO2 and what to attribute to the particulate matter. So the scientific community is, in 2018, there was a very huge, substantial study, COMIAP study, that tried to make a decision here. So how do we attribute this to individual pollutants? But that in the end didn't come to unanimous conclusion. So the conclusion was that the experts actually diverge on how to cut this. So we kind of took here a position, but you know, you could also take another position, and then the share of NO2 becomes a bit bigger, and then the share of particulate matter becomes a bit smaller. So this was basically the first important element in the study to investigate. So what are these total costs due to air pollution? And in the second part, we also investigated, so can we actually relate this to some transport related indicators? And that was interesting because we took the the urban audit database, basically as a starting point in our research. And also the urban audit also gives, for many cities, gives actually information about some indicators, transport indicators. And then we figured out that actually, if we want to include all the transport indicators, which we would prefer, we would only leave out 79 cities that we regarded as a bit too minimal. So we selected here a few indicators so that we would have a bigger sample. And then we did this regression analysis. So we were investigating, so can we say something about the level of reported air quality and the influence of that by the transport indicators. And the finding basically here was that, okay, we generally see that transport-related variables plus household heating, so the transport-related variables that we could identify in this research, that they influence around 30% of cities' air quality. So this is not to say that this is the share of transport, but I think it is a fair share, 30%. It could be a bit higher. So it's also important to know that it is not only about transport that is actually making the air quality in the city. And in our model, basically in our regression analysis, we figured out that car possession actually is an important and significant explanatory variable. If car possession in a city could be halved, the city's air quality tend to improve by around a quarter. And we also investigated that not only the car possession, but also the journey time to work was significant in our estimates. So journey time to work, if it could be halved, then the air quality would be improved by 15 to 27%. I want to emphasize that this research is kind of preliminary because the data situation was not that great, and of course we didn't have time or capacity to investigate, to collect individual data on cities in a comparable way. So that's a good thing. If you use the urban audit, then you do have comparable data at the city level, but the many cities actually do not report all the variables, so there are many omissions in the database. So this brings me to the conclusions, basically, of our research. I think that we can definitely state that air quality in cities is an important determinant of public health in those cities. I also think that, and that we also outlined this in the report, that this has also a link actually with the COVID-19, because we see more and more evidence now popping up that actually COVID-19 is an important a variable actually that is influenced by the air quality in cities. So, and all these impacts on COVID-19, of course, have not been quantified in our research. So we only looked at the 16 endpoints, but we didn't attribute any of the costs from COVID-19 to our cost estimates. The outcome in our report is also that every citizen in Europe loses annually over 1,200 euros in welfare due to poor air quality. So it should also matter for politicians that want to improve the welfare of their city population, because this is an important factor. You know, you can, if you only are trying to improve income traditionally by stimulating economic activities, then you miss the point basically, because there is a very huge substantial area that is causing welfare losses to your city population. And I do have the impression that stimulating economic activities has some priority often at the city level. So our research actually shows that, well, you could consider you could reconsider this on the basis of our study. So I also think that a conclusion in our study is that, and this we didn't know beforehand, but I find it at least surprising that this differs so much per capita between cities. So there are, and of course, you know, Bucharest is landlocked city, you know, so all landlocked cities tend to have higher per capita costs, and I understand that Tallinn, because of the location near the sea, so there is less pollution from the surrounding area, but that's not the only story. The story is also that cities differ actually in the way they organize their their transport activities, the way they organize their heating systems. So so this is also surprising that there's so much variety between cities. And if we look at then, so if we express this this value, actually this welfare loss to their income, then it is almost 4% of income. And again, we see a substantial spread, as I outlined earlier, that some Eastern European cities they come to the near 10%, while there are several cities that are between the 1 and 2%. And also as an outlook to the next part of the research that we will start, we just started with that we want to investigate. So transport policies do matter actually for air quality, and that they can be a key in reducing the social cost of air pollution. So thank you all for your patience and for your attention. Here you see some information still on our institute. We're a Dutch-based non-profit consultancy group, and I wrote this report together with my colleague Joukje. Well, thank you very much for your attention.
Thank you very much, Sander. And if you allow me, then I will proceed immediately to the questions, because that's basically the heart of of the debate. So maybe I present a few. I can see on the screen. The first one from Andreas Kerschbaumer is, why were urban audit data used when there was enough information from the European Environmental Agency? So that's the first question. Then there is another one. It is a bit more complex. How does it come for that example Berlin has PM10 concentration slightly above WHO target values? Apparently 83% of the total damage cost stems from PM. And at the end, Berlin is between the top 3 cities with the highest total damage cost of air pollution in 2018. So that's, and if you allow me, a third one. The third one is actually about brain disease or neurological diseases. Jacques Rice is asking that the impact on brain and neurological diseases has been ignored in your study. Therefore, the economic consequences might be more important. So would brain day of the world? Yeah, sorry. So that was the question. Yeah, so maybe
Okay. Yes, thank you, Zoltan. I just have the questions now for me, because I was not so handy in writing them down. To start with the latest question. So the impact on the brain and the neurological diseases, they have indeed been ignored. And the reason for that is that we conservatively stick to the WHO guidelines from 2013. And the WHO, they were already conservative in their presentation of the impacts. So they discussed, for example, impacts that air pollution could have on diabetes, but then they concluded that there was not univocal, so not unanimous, I'd say, evidence for this. So they discarded this. So I do agree that there are many studies out there, and especially over the last 7 years, that would merit also including in an update for the WHO. WHO is busy with this, but yeah, they do not. We do not expect an update before 2022. But probably, you know, if that is included, then we would include it as well. So we didn't do a separate investigation, you know, to do better than the WHO. So we simply stick to the WHO guidelines. So then the question to Berlin. Well, you know, even pollution at the WHO targets is causing harm. So these targets are not like thresholds. So these targets are you know, not based on scientific evidence that below this you have no air quality. You have no air quality problems. Traditionally, it was this way. So these standards basically stem from an older area of health impact research, when it was thought that, okay, below thresholds, actually, you can pollute because you do not suffer from it. And this was really, in the 2013 guidelines, this was rejected. So they said, well, even very small doses of air pollution do cause harm. So you can be at the target value and you can still have considerably damage from particulate matter emissions. The reason that Berlin is in the top 3 is also referring to the population size, of course, in Berlin. We also suspect that, you know, cities differ in how they monitor their air quality. So if we look what was reported to the Eurostat's urban audit, then in some cities this was actually quite a lot lower than you could expect from if you looked at the information from the monitoring stations. So and in Berlin this was not the case. So in Berlin you can clearly see that they chose also themselves to give an accurate, well, what we perceive as a more accurate picture on the air quality than probably would have done in other cities. But you know, this would be really an investigation at the city level, and then you cannot do it in this research. So I would, you know, everybody it would be good if in Berlin it would lead to a specific study for Berlin specifically. And then the latest question was on the urban audit data used. Yeah, why did we use that? Well, you know, if you have a monitoring station, then the question is, yeah, how do you average that over the city? So basically, you would have to if you use the like many cities. I think that Berlin has around 9 monitoring stations for particulate matter emission, maybe a bit more. And then the question is, yeah, okay, but you know, this is not representative. Is the average representative for the air quality? Or is there has it been placed in a grid so that we can determine, you know, on street level, so how many people live there, how many people come there? You know, you can do a very detailed modeling of the spread of air pollution over a city, and this will all influence the results. Of course, this is not possible in you could do this for one city, and then you would have a longer trajectory in studying than we did in this research. So our research is primarily about reported air quality. We use the information from the EEA to update the urban audit data, because the urban audit data, the latest year that we had a full sample of air quality was 2013. And so we used the monitoring stations, the average of the monitoring stations, the cities, to update this to a 2018 figure. But we didn't use it as a prime source.
Yeah, thank you very much, Sander, for elaborating on those aspects. We are closing to the end of that part. There were some questions about sharing references on diseases. We noted that, and we will come back to that after the event. Also comment from concerning Berlin, so please have a look at the chat box. But maybe if within 30 seconds you just can elaborate, there's a very important aspects of health inequalities. So Louise Dupré actually is raising that we can see inequalities between European cities. Did you also look at the inequalities within cities? And Michel Salter agreeing with that. So just very short.
No, that is something that we did not do. So we used just an average of city with respect to the incomes earned. And so, yeah, it would be interesting. You know, the value of this study is basically that we applied a uniform method across many numbers of cities. And yeah, if you would investigate an individual city, you could investigate, you know, are the poorer quarters, are they more polluted than the richer quarters? Which is, of course, socially very interesting finding. However, we did not, yeah, could not do that in our research. So that would be really interesting to investigate that at the individual city level.
Thanks for that, Sander, and maybe that's also something cities can consider as one of the follow-up actions. So with that note, we are moving to the second stage of the event, the panel discussion. So when I'm kindly asking speakers just to turn on the camera, I would like to start with displaying the video from Veronica Manfredi. Assuming that you can see my screen, I will start with that immediately right now.
Hey, colleagues, good morning, and many thanks to the European Public Health Alliance for organizing this public debate on the health cost of air and transport pollution in European cities. Please accept my apologies for not being able to participate live. My colleague, Mr. Vicente Franco from our cleaner unit, will be staying with you and available to take questions later on. On behalf of DG Environment, I would like to welcome the study commissioned by the European Public Health Alliance. We still have to analyze it in depth, but given the track record of its authors, we expect the study to be an excellent contribution to the public debate about the true cost of pollution. Currently, we are working intensively to design the Zero Pollution Action Plan, the key deliverable of the European Green Deal put forward by the von der Leyen Commission and due for adoption, as you know, next year. We are pleased to see that some of the themes put forward by the European Green Deal are strengthened by the concrete figures the researchers have found in the study you will present today. Allow me to highlight just three of these themes. First of all, the urgency to act on pollution, which emerges clearly also from your study. As you know, according to the recent report of the European Environment Agency on healthy environment, healthy lives, no less than 1 in 8 deaths every year across the EU can be linked to environmental pollution. Air pollution in particular remains the largest environmental burden on human health in the EU. Second, the results of the study show that large difference and inequalities persist within Europe when it comes to the impact of all kinds of pollution. What is more, we see, as confirmed by increasing epidemiological evidence, that also your study shows pollution often affects the most vulnerable people. For instance, the elderly, those with lower income, those with pre-existing medical conditions. And the third thing, the economic calculation of environmental impacts, as challenging as it may be, is indispensable to ensure that environmental health issues such as pollution get the due policy consideration. For us, it is obvious that the green transition championed by this commission does not just make environmental sense, but also a lot of economic sense. However, some are less convinced, we all know, and the study presented today, in our view, usefully adds to the existing body of evidence. To conclude, a few words about the upcoming Zero Pollution Action Plan. It will set out a vision and key concrete actions supporting a zero pollution ambition for the years. We want to develop it as a compass, pulling the strings and joining forces across all relevant policy areas and providing a better integrated, more compelling quantification of cost and benefit for our societies and economies out of stepped up efforts to cut pollution at source. We want also to help drive more conscious consumer choice.
Zoltan, you're muted still.
Yes. Yeah. So I think with that message, then we are right at the heart of Europe and the European policy decisions. What we have having a discussion about what science says. Then how does it marry with policy, and maybe this is then the right opportunity to discuss with that. So I am pleased then to proceed with that message in our mind, having the wider European framework to the debate. And I would like to invite first, following the agenda, MEP Bas Eickhout, as you are sitting in one of the main European co-legislators, and actually the only democratically elected one, the European Parliament, and having followed in relevant policies impacting transport. Maybe you would like to share a few thoughts about the study, and how do you see it Europe can help or hinder a move to sustainable mobility?
Yeah, thanks a lot, and good morning, everyone. Well, first of all, Sander, thanks again. As always, very good reports and helpful insights. And I have to say, if just reacting immediately to what I find most striking, I think we know a bit, of course, how costly air pollution is. But I think what this study very much adds to it is the inequalities, the differences between European cities, how huge that is. And I think that should be stressed more, that air pollution is contributing to inequalities within Europe. And in that sense, the question of some of the participants, can we also look at it, how the inequalities play out within the cities, is, I think, a good additional question, because I would not be surprised if you see that air pollution will add also for further inequalities within cities, hitting the poorer parts of a city harder than the richer parts. And I think that's probably, and I very much understand, Sander, that you didn't go into that, because that's a next research, I'm sure, but I would not be surprised if we see the same kind of augmentation of inequalities within cities as well. And I think that is certainly an additional point that should be raised much more about when we are addressing air pollution. The second point, which is striking, and that surprised me as well still, is how big the impact is of transport policies. And I think that certainly also deserves some further attention, but coming up to 25%, that's really, I mean, we know policies matter, but 25% is really a lot there as well, where if we talk about one specific sector. So I think that's also interesting to dwell upon, because I hope with this more city analysis, we can also learn from each other, because that is very important, that cities can learn from each other and what are the best ways of dealing with it, and which ones are successful and which aren't. And we know, of course, a couple of measures that can be successful, but it's also good to show what the impact is and how it is contributing to cleaner airs. Then bringing it a bit to the European level, where can Europe help or hinder, as you put in your question, which unfortunately I have to admit that sometimes Europe also hindered here. I think maybe to make that very clear from the start, Europe failed on cities. We have failed on cities to clean up the cars. I mean, we have had years where we failed to really clean up cars. We were not very ambitious in the targets we were setting. And well, Dieselgate painfully showed how we were not implementing it. And with that, you are forcing cities to, what can they do additionally, right? I mean, I know in many countries we now have a discussion on maybe doing some certain environmental zoning and keeping cars out of certain parts of the city. But that's, of course, a measure which cities don't prefer to take, but they were forced to take these kind of measures because Europe failed on them. And I think that cannot be forgotten often enough. That immediately brings me a bit to a danger of that discussion, because for sure, at the European level, and we heard it already a little bit in Veronica, and I'm not saying I disagree, but of course then Europe always comes up, we are going to clean up the cars further. Next year we will come with Euro 7 standards, so it will all be better. We will do better implementation. We might discuss about some further pricing mechanisms. We love these kind of instruments and political instruments, where of course one of the key is, it's not only about cleaning the cars, it's also very much more stimulating the alternatives to cars. And I think that should be much more at the forefront. And we know that in December, the Commission will also come with a mobility plan strategy. I think very important there is, yes, of course, in some of the tools we have, we should clean up the cars faster than what some are claiming is possible. But I think more important is, how can we now really stimulate the alternatives? How can we stimulate less possession of cars? Because we all know the possession of cars is stimulating also the use of cars. And these kind of discussions need to be there. There, of course, the cities can play a role, but here again, I think it is very important to really learn from each other, but also at the European level to start that debate that it's not only about technology cleaning up the cars, but also really looking for the alternatives, which probably is even more important than just cleaning up the cars. Because we also know, even if you have the cleanest car later on, so think of electric, then there will be still a lot of fine particles coming from those cars, maybe not from the engine anymore, but still from the tires, etc. So cars keep on remaining even if you don't have a combustion engine anymore. And I think that's my last point. If we can learn something from COVID, is that you see how in cities can really change policies and how drastically and fast that can be done, and how much support there is by us as citizens. I mean, it's always, change is difficult, and people are always into, they love to do what they did yesterday. But I think COVID shows that change is possible, and in the end can get a lot of support. I see Louise. I think that's certainly also clear for, we all live in Brussels, at least a lot of people here, and we see the changes, and we see it is impacting. We do also see that there is still a big problem with possession of cars, and that a city cannot do that. Maybe more national policy making, but this needs to be combined, European, national, local, in order to really address these issues. And I think this report only stresses the importance of it, and I would like to thank for that. One final point, I hope in this debate we will not fall in the trap of the question on how uncertain, how certain are the numbers of the report, because this is what I would say the more progressive politicians always do, being holier than the Pope, talking about the uncertainties which are there. But do you think the car industry is ever clear on their uncertainties with their cost estimates on any of the EU policies which they throw in the debate every day? No, they don't. They don't talk about uncertainties. They do claims about bankruptcy, the end of the car industry in Europe. There's quite some uncertainty around those statements as well. So let's not be holier than the Pope there. So thanks a lot again, Sander. Looking forward to the discussion.
Thanks for making those points. And indeed, cleaning the cars and alternatives and having cities are the cornerstones of the discussions. But also don't forget, we are talking about that. We are talking about people, citizens, and consumers who should make choices. And then maybe Dimitri from BEUC has something to share. How do you see from a consumer view that could be possible or not?
Thanks, Zoltan. And first of all, thanks as well from my side to IFA and CEDEL for this very, very, very good study, very good report. The findings, I won't repeat it, the findings are indeed adamant. Air pollution, which is largely due to transport pollution, but not only has a very high cost toll on our societies. It affects especially, even if we probably need some further research into this, but it affects especially low income and vulnerable consumers. So that's a key finding too, the poorest are hit the hardest by the air quality crisis. And it's not only limited to big cities. That's also something which is interesting. Like in the list of the 10 most affected cities, you had some middle-sized cities such as Padova, for instance, where you could think, well, I'm not mostly affected by air pollution, but indeed you are. And if you allow me to put it like this, Sander, you said that yourself. These are very rather conservative assumptions. You didn't integrate, for instance, this brain and neurological dimension. We heard it during the debate after your presentation. And if you allow me to put it like this as well, this report is only, so to say, about health costs. Talking about transport, if you add to this spendings in fuels for consumers, for instance, the huge amount of time wasted in congestion, or the huge waste of public space which is dedicated to individual cars, I would say, like the costs are much higher. So to respond maybe to Bas' remark, I think people who would doubt the findings of the report will only need to make the cost higher. I think that's the way we should look at it. And as Bas really rightly pointed out, I think that's something that we need to remember and repeat always more and more when we hear people arguing about too ambitious policies, too ambitious sustainable and environmental policies, creating like being very costly, or which makes us run the risk of creating more social hardship. This report shows that there is a high cost of inaction, or a high cost of unambitious action, let's say. So now, what do we do about it? If I focus on transport, which is one of the key dimension highlighted by the report, I think the general objective is indeed to make consumers move towards the most sustainable transport option. But for this to happen, you need to make this most sustainable transport option available first, of course, attractive and affordable. And unfortunately, often this triptych is not met, and often, like it's more luxury to move more sustainably. For instance, if you take the train costs more than the plane, for instance, to go to a holiday destination. That's something that we need to address. And you highlighted the importance of of the polluter pays principle. At BEUC, this is a difficult thing to discuss with consumers, but just to say that from our views, the polluter pays principles need to be better applied, but it needs to be carefully weighed so that it doesn't put more difficulties on poorer and more vulnerable consumers. And we saw that with the recent protests in France about the higher fuel costs, with people complaining, I have nothing against environmental action, but if I'm trapped into a consumption model where I need to use my individual car, I have a fundamental issue, and you just make me pay more while I have no alternative. So to move to the option, to the solutions quickly, we need indeed to clean up cars. So Bas mentioned Euro 7, the next wave of CO2 standards, also the Alternative Fuels Infrastructure Directive, which should contribute to making electric cars, which are not the perfect solution, but which are much better, without any doubt, than diesel and petrol car, more available and more attractive to consumers. That's something that we need to work on, and there will be a big legislative package coming next June that the Commission will present, where these things need to be addressed. But I would say, most importantly, you need to make alternatives to individual cars more attractive and more affordable. And we saw indeed in the COVID-19 crisis that when you put up some temporary bike lanes, they're quite quickly taken up by people, and not only in city centers. You have statistics, for instance, in France, of a big increase of bike use also in rural areas. So it's not something reserved again to the rich people in the city centers who can have a choice between 10 different transport modes. Another key point, and here again, let me stress the importance of the sustainable and smart mobility strategy that will come out at the end of the year and will be presented by DG Move. We need to make public transport more attractive. So that means bigger investments, of course. There, the recovery plans might help, but this means as well making the whole system more attractive. For instance, encourages single ticketing, by which a consumer can switch between different modes of transport using a single ticket. Right now, we have fundamental issues with this, and that hinders also the attractiveness of public transport and rail, for instance. And so I would say, that the Commission has said the 2021 would be the year of the rail. That's a good commitment, but that needs to go much beyond the nice communication exercise and translate into tangible changes for people. And the last point is, again, the pricing and the fair polluter price principle. Again, this polluter pays principle needs to be applied in a socially just manner, meaning that you need to put a higher price tag probably on polluting activities, but you need to make sure that the revenues stemming from these taxes, for instance, is used the right way to provide alternatives to people, to provide more public transport, more cycling lanes, etc. And that the price signals need to be both negative on polluting activities and positive. For instance, purchase premiums for electric cars may be targeted at low-income people who don't have a choice but to use their car to commute to work, for instance. So I will stop here, but thanks again for the report, and looking forward to the debate.
Thanks, Dimitri, for that. And it is compelling and astonishing to some extent that it is not the first point. The health inequalities or inequalities aspect is coming through, and this is indeed it matters also for consumers. So thanks for that. And yes, the choice is complex. Here, just to remind participants that you can use the chat box, so you can put forward questions to the panel. Hopefully, there will be time to address. And I'm also happy to see the Cleaner Healthy Cities hashtag is very active. And just allow to bring to the discussion, actually, Sasha wrote in the comment that important to take into account the sport utility vehicles. So, which in many places like Bucharest is considered as status symbols, and also some parts of Europe as in Brussels. But talking about inequalities, alternatives. You mentioned bike lines. I think there is a good point to move to the eastern side of Europe. And Benedek, maybe the point of view from a capital, from Budapest, maybe you can address that point.
Thank you, and thank you for the opportunity to be with you today and to meet many old friends, especially Bas Eickhout. Hi, Bas. Good to see you again. And yes, I think that the perspective which an Eastern capital represents is an important one to be taken into consideration throughout the discussion. As the report clearly points out, Eastern capital cities, including Budapest, are among the most hit European cities. Budapest, Hungary is on the third place. Budapest is among the 5 capital cities in Europe with the highest per capita costs of air pollution. So clearly, and the other 4 are Bucharest, Sofia, Warsaw, and Bratislava. So clearly, the eastern part of Europe and the capital cities, and I'm talking about capital cities here, are facing with an especially important and strong problem. When it comes to money and the cost, it's even more shocking to see that in the case of Budapest, more than 3 billion euros are the yearly costs of air pollution in the city, which represents more than 6% of the yearly GDP of the city. And in comparison to the city budget, it's even more shocking. It's more than double of the yearly budget of the city. So it's not a kind of marginal problem, or the costs are really overwhelming the city budget. And that puts, I think, the problem in the heart of any discussions regarding climate transition and sustainability of cities like Budapest. And also, I think that it's important to take this into consideration when it comes to the question of possible European solutions, because the problems have a slightly different route in the region. So mostly we speak about transport emissions, but in the eastern part, heating is a major source of air pollution, partly because of the low-income groups using sometimes wood, but in some cases simply trash in heating. And especially in the heating season, in some parts of the country, or perhaps this is not mainly a problem in Budapest, but in cities in the countryside, it's really an important problem that trash used in heating is the primary cause of air pollution in those cities and regions. So we have to find solutions not only to transport emissions, but also to heating emissions, which also takes us to possible solutions, including how to transform the transport system. And I completely agree with those who mentioned this before, that it's not simply the problem of the engines and how can we clean the cars, partly because stricter Euro 7 or stricter emission standards for cars, what will this be resulted in the Central and Eastern European member states? Cheap diesel cars will flood the region, because in Western Europe, people are not going to buy or they try to sell the already existing diesel cars, and most probably in the Eastern member states, many people will just jump on the available diesel cars. So this improvement of the European legislation can have a slightly different effect in the Eastern member states. And I also agree, and just to cut it short because the time is quite limited, that when it comes to solutions, first I think that it's important to see that especially in the Eastern member states and Eastern capital cities, the support for public transport is one of the most important solutions from European sources as well. And it was mentioned in at the beginning that Tallinn performs surprisingly well. Let's keep in mind that Tallinn decided in 2013 to make public transport completely free. And of course, there are different, perhaps other effects as well behind the good performance of the city with the geographic situation and so on and so forth. But I argue that that a free public transport in the city of Tallinn contributes substantially to better air quality performance. And also it is important to remind that sometimes in the Eastern capital cities, public transport, which is good, but it's also a source of major pollution, because sometimes, and that's the case in Budapest, the bus fleet, average age of bus fleet is over 20 years. And old Euro 3 diesel buses are serving public transport in Budapest. So I think that the major European program to clean the public transport fleets of Eastern capital cities should be an important step forward to improve the air quality situation in those cities. Together with, and we see the renovation wave published or launched last week as an additional important element. And I agree again, that was mentioned that the RRF, the Recovery and Resilience Facility, should target a green transition and green recovery, and that is extremely important. And here, and that should be perhaps my last remark, here I think that the cities must be an important partners, allies for the European Commission, because in those member states, national governments very often are quite critical towards the increased climate targets of the Commission. There is a high risk that the additional sources, but also the traditional ERDF sources and cohesion fund sources are not going to be used to climate action, to improve air quality, to be invested in green economy, but partly to save old-fashioned polluting industries, and partly they will be lost through corruption channels. And here I think that cities, where the city leadership is much more progressive, they completely committed to support the higher climate targets of the European Commission, and they have in mind to improve the air quality situation in the cities, should be in a special alliance with the European Commission to work together on progress in this area, including, for example, opening the Connecting Europe facility to cities for major transport projects, which is already in the Council's negotiation position, the Nagel box. And there are some additional possible solutions how to improve the links between the European institutions and the cities to become really effective in a major improvement in the situation.
Thank you very much, Benedict. Many good points indeed, just about the climate that surrounds all of us, and highlighting the public transport. It is also very important. It should be part of the discussions. In Luxembourg, it also make it free, so it is not. So it is a good solution. But that also reinforces that cities should be in the driving seat. And you just mentioned many examples. Also, Bas highlighted at the beginning. So let's learn from each other. And maybe that's with that we can move back to the discussion from the east to the west, as also you highlighted the link, and especially the diesel link, but there are also other links and also good examples. So I think Louise already made a very good point on the health inequalities in before, but maybe she has something to share about what Brussels did and what could then actually initiate change, which we can see.
Okay, thanks, Zoltan. Can you hear me?
Yes.
Yes, okay. I'll try to be brief looking at the time, and a lot of very interesting things have been said by the other panelists. So I will just try to highlight a few things that have not been said, and perhaps talk about the Brussels perspective, which a lot of you might know from being based here. A great study. We will also use it and share it widely. We're also doing a similar study, but more looking at the future and looking how phasing out diesel and petrol cars could help save lives and saves on mobility costs, and also looking at these economic costs. So I will be busy comparing what you show in your report and what we're doing. We're planning to release that next month. The study is ready, but it's being translated, etc. So I'll also share it with IFA. Very briefly on the cost, I very much agree with what Dimitri Verne said about the fact that this was just a portion of the costs of air pollution due to traffic in particular, because that's, at least in Brussels, this is one of the main culprits when it comes to bad air quality. And also the fact that some of the solutions would bring even bigger benefits, which are not even depicted in the CE Delft study. And if we look at active mobility, so walking and cycling, which are the alternatives to using a car in a city, which makes perfect sense. Especially in Europe cities where you can do a lot by walking, not even talking about taking the bike, but just walking, it's possible. And then if it's longer distances, you now have the bike, and even by electric bike where you can go even further. So here you would have some benefits in terms of being more healthy, which are huge and which, as far as I understand, are not at all quantified in this study. So the benefits would be even greater than what we see here. Looking at solutions, and maybe to say a few words about what Brussels is doing, but I also want to say a few words about the role of the European Union, which is crucial, not to minimize what a city can do. Of course, there's a lot more that can be done in Brussels. So to start with Brussels, what is being done, it's mainly two things. One, and the most important, as Bas Eickhout said, if you want to reduce pollution from a car, you just have to make sure there's no car, not even an electric one, especially not the very big one we're seeing on the roads now, which also emit non-exhaust, which has been said. So the main one is a regional mobility plan, which has been adopted a few months ago, and which is quite ambitious. Now, the question is how to enforce it and make it reality, and which aims to reduce by 25% vehicle use in Brussels by 2030, compared to 2015. And there are many ways of doing that. I'm not going to list everything, we don't have time, but a very important one is to promote public transport, walking and cycling. And you've seen during the Corona times, for those who live in Brussels, that this has been sped up with 40 kilometers of bike lanes, which have been developed very quickly. Also important is some traffic calming measures, and as of next year, the rule is going to be 30 kilometers per hour for cars. So traffic calming, having cars that drive much more slowly, this is becoming the rule. This is quite important. And also working with traffic calming neighborhoods. This is being developed by colleagues in Bruxelles Mobilité. And they're starting already this year with this. The second type of measures is the motor shift. So this is the low emission zone. This is what I'm busy with within Brussels Environnement, and basically accelerating the renewal of the fleet. So Brussels is a low emission zone, the entire region since 2018. There's a lot of cameras which have been placed. So fines are being sent automatically for cars which don't comply. We see that it works very well. This enforcement regime, the fine is quite high. It's 350 euros if you don't comply with the low emission zone scheme. You can look on our websites. We're doing annual assessment of the study. We just published a second one for the second year, and we see it works quite well. And we're now looking at strengthening this by the end of the year by phasing out diesel by 2030 and petrol by 2035 at the latest. So we're busy modifying the legislation. When it comes to the EU, I see the time is running. I will try to do that in 2 minutes. But just to say that these measures will help us reduce emissions, basically of NOx emissions, nitrogen oxide, black carbon, to some extent particulate matter, but the sources are much more than road transport. So here we're stuck. We know that in the spring, when we have very high PM 2.5 concentration levels in cities like Brussels, but not only Brussels, I know it's the same in other cities. This is mainly due to ammonia from agriculture. This is just to give you an example, just to say that for PM, the sources are coming to some extent from outside the city and from other sources which are not only traffic. And when it comes to ozone, actually those measures on transport, as far as we can see, is not really helping because of the complexity of ozone formation. So this is where the European Union comes into play, and I will try to, in our opinion, what the EU can do to help cities to improve air quality. The first is to reduce emissions at the source. This is what the EU has been doing now since decades, and which has shown to work quite well. We know that thanks to industrial policies since the 70s, 80s, emissions of sulfur dioxide have dropped significantly in the European Union. So there's a lot of success stories to show here. And this is thanks to European legislation, which has been implemented in the member states. What the European Union should do now is also to accelerate that for road transport, agriculture I mentioned, also other transport sources which are not traffic, for instance shipping. We know there's a lot to be done, so there's still a long list coming. The second one, not to forget, is the Ambient Air Quality Directive and some standards to really protect public health. I just want to repeat again that if cities like Brussels have adopted low emission zones, this was because there was EU ambient air quality standards, which citizens have been using before the domestic courts, and also the Commission also putting pressure, not enough, but putting some pressure before European courts. And this really triggers some action at the local level. So I don't think we would have a low emission zone if it was not for the NO2 limit value. So the EU should really update those standards, make sure they're following the latest health advice, which is not the case at the moment for PM 2.5 and soon will not be the case for NO2, as we see, and enforce those limits. I will stop here because I see there's just 10 minutes left, and leave Zoltan take the floor so that we can continue, even if I had other things to say, but for the event, I think I will stop here.
That's really helpful, and thanks for that. But you were making many good points, pragmatic ones, and also nicely mentioned what the EU can do, and ultimately that's also the general framework of the discussions. Time is passing. I have seen questions about the and you can see as well about company cars and highly subsidized. So what can we do about that? That the heavy good vehicles can be also addressed in a way. Maybe what we can do is just to proceed with the short panel tour, also allow you to share some words or reflections you have done before moving to the conclusion. So maybe just go with Bans again. So if it would be possible within 1 minute per speaker, it would be good. Thank you.
Well, very brief on the company cars. This was exactly why I was referring to when I was, for example, giving the example of Brussels, which is certainly suffering from a Belgian measure on company cars. I mean, in Belgium, because of tax reasons, almost everyone has a car. And then, of course, as I said, car possession leads to car use. If you then need to decide the next morning and you go out of the door, well, the car is there already, so you get into it. So there's a lot of useless car movements in big cities, and certainly in cities where there is a lot of car possession. So here, I think that part of the stimulus of car possession that has been done by the government, I think by many governments, I think is really one of the topics that also should be addressed when we are talking about a mobility strategy by the European Union, because this is really one of the big problems. And that also links a bit to the status symbol. Yes, of course, a car is a status symbol, but it's also very much being stimulated. So don't take that for granted. Smoking was also a status symbol 10 years ago. So also in culture, a lot of things can change. So don't take things for granted too much there. That was a minute.
Thanks for that, Dimitri.
Very shortly on company cars, I very much agree. And I think this is another, maybe it's a benefit in kind. So it's another domain where you can correct the bad signals that is sent by policymakers. Like the company cars, who do they go to? To people who are maybe not the wealthiest on earth, but who can afford, who could afford the car themselves or another transport mode. So let's say we could save a lot of public money in this by modifying the labor taxation, etc., and investing this money more wisely into public transport, cycling lanes, etc. So just to put it, it's another illustration of how you can, nudge people to use better modes, and to the benefit of the whole society and themselves too. Most of the time, you have many people who don't really wish their car, but they're almost imposed to get it because they don't have any other choice. It's either the car or not really a revenue increase.
Thanks for that, Benedek.
I think there is not too much to add on company cars. Also, that is a problem in Hungary. As for a city, of course, the regulation on taxation of company cars belongs to the national government. So we would like to see a better taxation regulatory environment, not to support company cars. And there are some very good studies showing that how much money is lost through subsidizing company cars. But I believe that is a little bit beyond the city competences.
Thank you very much. And then Louise again.
No, I agree. Nothing more to add. Maybe the European Commission can continue putting pressure on national governments that help. I know there are discussion about the recovery and resilience facility, and I mean the European Union can also decide to put pressure when they can give money and say, I think they're doing it already through the semester. I know it's hard, but that helps cities.
This is the moment when I really would love to continue the discussion. It is just not possible because of the time, but I'm very happy that I'm sure the Commission is listening, but Vicente was with us. So then I think this is something to bring home, and then something to reflect, and also with other implications the European Commission, also other units can deal with. But I'm afraid we have to move on with the final part of our meeting. It is my great pleasure then to invite Anne Stauffer, Deputy Director from the Health and Environment Alliance, to make her concluding remarks based on the discussion. And you have it.
Thank you, Zoltan, and thank you for the opportunity here to provide some remarks on the part of HEAL. We're an alliance of over 90 member organizations working for better health through a healthy environment, and actually air quality, good air quality, both outside and inside, has been a priority for us since we were founded. And I want to make some brief remarks and focus actually on the policy dimension, but first say that we welcome this report as it adds to the body of evidence on how air pollution impacts us and how much it actually costs us. And it shows again that the costs of air pollution are unacceptably high in Europe, and that we need to act. So I think, you know, you can have different methodological approaches, and indeed there are uncertainties, but this should not prevent us from acting. And we have seen some encouraging sign here at the EU level, which I get to, which is good, that air pollution is now firmly a priority on the political agenda, but I think also with people, because people in Europe, they want clean air, and they're increasingly making their voice heard for that and urging the policymakers to act. I think it's also really good that your report has a focus on cities, and that there is more awareness and policy action on cities as the places where most Europeans live, and where they experience you know, also changes very immediately. And I think again with people there is an increasing interest and concern about having a livable city, having a city that is healthy, that protects their health, and is also good for their well-being. And even before COVID, with what we heard now with more cycle lanes being set up, even before COVID, many cities in Europe were actually front runners for clean air and taking all kinds of measures for healthy mobility. And so this is definitely something that needs to be supported and nurtured, and also something that where now with the recovery plans, we need to you know, give cities the clear opportunity and the financial backing and the political backing to continue on this path of building back better. And I was happy to hear what was being said about active mobility, because indeed in walking and cycling there are huge opportunities. It's a triple win. It's good for our health, it's good for the air, and it's also good for the climate. So this is really something that should be prioritized. But of course, the cities, you know, they can only be as good as the political framework allows, and they really need to have the political backing and right framework from the EU level. Because as Luis mentioned, what has prompted action in many cities in recent years was actually the clean air standards and the requirements to keep the clean air standards. And when I now look at the EU level, there are really, really important opportunities in the next months. Actually, the next months will be crucial for setting Europe on the path for clean air, for health, for all. With what was already mentioned, the updating of the EU's air quality standards, we were quite pleased to hear the commitment to aligning the standards more closely with WHO. Of course, we as HEAL and many of the health groups say this needs to be a full alignment, not on a step, but it needs to be really health-based air quality standards to what the evidence tells us. Then we're also expecting a zero pollution action plan for air, water, and soil, and this is another key opportunity for all of you to be involved. The roadmap is out. There'll be public consultation, and I would like all of you to be engaged in this debate and having bringing your expertise, but having your voice heard on how we can actually move to zero pollution. As indeed there is more and more evidence that air pollution, even at low concentrations, leads to many health harms. So I think zero pollution is the goal and is the way we wanna get to. And then this also relates to making these zero pollution measures and ambition conditional also for the recovery actions. So indeed, to prevent that polluting economic ways of lives or industries are being financed, but to really allow for the recovery for a shift to a healthier environment and better health for all. And the last opportunity I would like to mention are the ongoing discussions also on the EU's climate ambition. As you know, air pollution and greenhouse gas emissions often share the same source in the burning of fossil fuels. And I think it's really important that we make the switch to switch from our addiction to the fossil fuels. So there's an ongoing discussion there about upping the EU's 2030 climate target. And again, this is an opportunity for not only us from the health community, but everyone concerned. And I know many citizens, people are, to make our voice heard and hold our leaders accountable for more ambitious measures. Because if we don't get it right, now is the moment really to get it right. And as I said, people want clean air, and we need to make our voice heard so that our policymakers follow suit on this. Thank you very much.
Thanks for that, Anne, and just reminding us a quite long list of actually where we can make a difference. And I think the discussions clearly showed that solutions exist. There is also new evidence, so we have a long way to go. With that, that brings us to the end of the event. So I would like to thank for all the speakers who dedicated time and shared their thoughts with us. I would like to thank the participants for your active engagement also on Twitter. Obviously, the debate shouldn't end here. We will also reflect upon the outcomes. Please notice the cleanair4health.eu website where the report is available. So also it is time to look at it. And with that, I would like to thank everyone's time, and then we are looking forward to work on this with you in the future. Thanks, and have a nice day.